Nurses, it's Wednesday and I'm spending time with you to help on this journey. We're going to be talking about, the journey of passing NCLEX and what it takes to get there. But in the meantime, before that, I want to make sure that you know tonight's topic is hyperkalemia, hypokalemia. I do spotlight one of my NCLEX review products every night. So this topic, actually, we go over the signs and symptoms of hyperkalemia, hypokalemia in the V2 student workbook. So tonight, I want to make sure that as you are watching that video, you understand the information. And I'm just going to put the pharmacology focus on it for you for this Winning Wednesday. If this is your first time joining and you're like, what is this? I'm studying for NCLEX, but I'm not quite sure what this is. Hi, my name is Professor Regina with remarnurse.com. I am the number one, the greatest NCLEX instructor on the planet. Every Monday and every Wednesday, I go live to help the Remar nurses who are on a journey to passing NCLEX study something from my NCLEX review program. So this is just another way for our community to join together as we are making sure that when it comes time for you to get your license, you are prepared. So welcome to our study group. Get out some pen and paper so that you can get this information. If you do have my student workbook, go ahead and add these notes to the electrolyte section. Hyperkalemia, hypokalemia is what we're going to be talking about. I want to also remind you that when you are preparing for NCLEX, the best thing that you can do is number one, study from one resource. That means you get all of your information from one NCLEX review. I don't want you doing YouTube videos, doing books from Saunders, doing Kaplan, doing Hart. No. Get everything from one place. And I know that you know that if you do this, you will be more dedicated, you will be more focused. So hop into my V2 if you don't have it. This is my NCLEX review. It comes with everything that you need in the subscription, on-demand lectures. They're right there waiting for you to get started. All you got to do is press play. My question bank, my computer adaptive exams. I have physical and digital books, very unique to my program, and the daily study calendar, all in one place for you to get your nursing license as quickly as possible. That's the goal. I also want to let you know that while you are in V2, I have another study session that I will be doing the month of June. I want you to come to it. I want you to think of June as the straight line. You know, if you're at point A and you're trying to get to point B, the quickest way to get there is a straight line. Well, my straight line for you when it comes to being prepared for nursing and NCLEX in general for the month of June is Remar Nurse University. That is happening every Monday in June. This is the straight line to being prepared. So it's actually going to kick off June the 3rd. We are going to focus on pharmacology, and I'm going to be intermixing pharmacology from my program to present to you. We're going to do cardiac medications June 3rd. Have you signed up for it? Renal medications June 10th. We're going to do pharmacology part 1. I'm mixing it all up. We're going to have some cardiac, some COVID, some diuretics. Oh, Remar Nurse University is so good. Oh, I can't wait. I'm really interested into how it's going to help you commit the month of June to preparing for your licensure exam. So we're going to do pharmacology part 1 in a simulation, and then June 24th, we're going to do pharmacology part 2. So if you struggle with pharmacology, let me tell you, that's okay. What you need to do is just take an additional step to make yourself confident in this particular subject. So Remar Nurse University gives you the opportunity to do that. It's really easy to join this free event. You go to remarnurse.com/RNU. And I hope to see you there. The workbook is so fire. I'm still formulating it. I'm on the final week right now. But I'm just so happy with the presentations that we will be going over. And it really is for you if you have to take next gen NCLEX, you want to focus on pharmacology, prioritization. If you want to be better at computer adaptive testing, delegation, it's a mock exam kind of feeling. So it's an NCLEX before the NCLEX, and it's happening every Monday, which we are accustomed to here studying every Monday anyways. So we're going to add it in the evenings. Remar University will be prime time, 8 p.m. every Monday night Eastern Standard Time. So it gives you an opportunity to get home, get dinner, get settled in, and boop, click on the internet, and let's go. Remar University. So I'm really excited about that. We have the special opportunity as a group to come together and study. Again, most of the information that I will be presenting will support you if you are in my NCLEX review program. I just want you to be extra confident before you take your exam. So anyways, we are going to look at the different aspects of it. I have more answers for you guys later on, those of you asking questions about what comes in the NCLEX review program. But we have hyperkalemia hypokalemia. Now, before I get into the slides for my audio visual learners, I do want to preference this by saying NCLEX can present hyperkalemia hypokalemia to you as a emergency situation, okay? Because potassium is so important in the cellular health of a patient. Usually when hyperkalemia or hypokalemia is presented, it is an acute situation. And so what we're going to learn today is not the physical signs and symptoms. Those are important, right? It's important that you know the physical signs and symptoms, but I want you to know the pharmacology that goes along with this condition, and also your nursing responsibilities depending on which situation your patient has. So this is very good information. Hyperkalemia, hypokalemia. Because we have the ending emia, we are talking about potassium where? If it's emia, then it's in the what? Is it in the cells? No, it's in the blood. So we're talking about a condition where you're having potassium, which is one of the 7 microminerals that patients need for their overall well-being, right? And potassium is essential, like I said, to many body functions, including maintaining the activities of the heart, the kidneys, the muscles. So when you have alterations in your potassium, it is going to show up in your body processes. Also, the ability for the nervous system to transmit signals from the brain to the rest of the body, nutrients to the cells. Potassium is supposed to be inside of the cells, and so we have problems when it leaks out. There are many conditions that cause potassium to leak out of the cells, right? And then also, so when we have an alteration in our potassium and we have potassium where it should not be, that begins to be a toxin or waste. Also, if the kidneys are involved, they're not able to do their job. So when potassium moves, sodium moves, and that is going to affect even more of our body's homeostasis, affecting the blood pressure, even affecting the blood pressure of our patients. So potassium for NCLEX should be studied. Now, potassium levels in the blood are determined by several things. So I have here, they're determined by, of course, the dietary intake of our patients. How much of potassium is our patient ingesting in their food? Are they avoiding potassium? So that is going to affect the potassium serum levels. Also, the distribution between the cells and the extracellular fluid. There are medications that we give patients that will draw potassium out of the cells. And there are also medications that we give patients that will draw potassium into the cells. You are responsible for knowing those medications. Of course, if you're here at the study group, I'm going to tell you what they are. And then also the urinary potassium excretion is going to affect how much is in the blood. So hyperkalemia is an increased potassium level in the blood. And again, we're going to talk about the difference between the hyperkalemia situations in our patients and the hypokalemia situations in our patients. The normal ranges for potassium in the blood do differentiate between an adult to a newborn. So in nursing school, we are focusing mostly on the adult levels of serum potassium. That is going to be 3.5 to 5. However, if you are a child or an infant or a newborn, you're going to have different numbers. I have them here listed on the screen for you. For next gen NCLEX, the normal ranges of potassium will be given to you. So you don't have to memorize this. I would say memorize the adult one. Any nurse worth her salt should know that normal potassium is 3.5 to 5. However, because NCLEX is giving you the normal ranges, it's more important for you to know what the irregular ranges mean overall. So hyperkalemia, we are talking about a blood serum level of greater than 5. We're talking about, they can be up to 7, right? A patient can have a potassium level of 7. A patient can have a potassium level of 8 if we are pushing it. So we're talking about excessively high potassium levels in the body. Most cases that are hospitalized with hyperkalemia are going to be caused by either medication or renal insufficiency. Now, other main causes or the conditions that are going to precipitate hyperkalemia, you should know. There is something called pseudo hyperkalemia, and this happens pretty regularly because if a serum blood sample is not taken appropriately, the red blood cells can be damaged during the process, and this will cause potassium to leak out of those cells. So when a potassium level is run, because there's damage to the blood cells, the potassium levels will be high. So what do you think the response to that is? If a patient gets a serum potassium level and it's very high, but the nurse is like, I don't see any other indications that my patient has hyperkalemia. What should I do? What should I do? Well, the correct answer is going to be to what? Yes, retake that exam, retake that sample. Great, 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 great. I am loving what I'm seeing in the comments. I got nurses from all over who on Wednesday night know whatever else is going on, I need to have myself in class, because these are the types of subjects that if you read them in a book, they're difficult to understand. But if you hear me explain them to you, you will remember them a lot longer, okay? Because you're learning traditionally. So pseudo hyperkalemia, now you know why it is caused. Okay, now let's go over health conditions. The health conditions that cause potassium to increase in the blood, well, you know them. They are mostly going to be related to your kidney function. So acute kidney failure, chronic kidney failure. These are conditions that are going to affect the renin, the aldosterone, and they are going to make it difficult for the body to reabsorb potassium, to get it into the cells, and to excrete it. That is where you're going to see hyperkalemia. Also, salt substitutes. So patients who have kidney problems, oftentimes it is recommended that they take a salt substitute, right? We've seen them. You probably can name some of them. My mind escapes me what they are right now, but the salt substitutes that our patients are using, they can increase potassium levels in the patient. So that is something that we need to know for NCLEX as part of teaching. And then, of course, if we know that Cushing's disease causes hypokalemia, Addison's disease can cause hyperkalemia. where the body is experiencing high serum levels of potassium. So please remember that. I go over Addison's and Cushing's in both the V2 and the quick facts. So make sure Addison's disease is something that you are spending time with. It's a must-know condition. Drug-induced hyperkalemia is just what it sounds like. So medications that you give, you're going to give these medications, and you better be checking your patient's laboratory values, because they can cause the patient to have increased potassium levels, which can be dangerous. So, for example, ACE inhibitors, beta blockers, they both can cause the patient's potassium levels to go up. If you did not learn that in nursing school, take hold of it right now. Take hold of it right now, because for Next Gen NCLEX, remember, you are going to be looking at a patient's history and their current medication that's ordered, or their home medication. And so if a patient comes in and they are on an ACE inhibitor and they have been on it for 3 months, am I going to be expecting them to have an increased potassium level? Yeah, maybe that will be related to the medication, but it is good for me to know that the medication is connected to the condition. So like I said, Remar Nurse University is coming up in June. We are going to be doing a lot of that, a lot of pharmacology work and making those connections. So I'm just focusing on hyperkalemia first. The symptoms that are going to be present with hyperkalemia are going to be a lot of muscular sensations, right? So you're going to have here, not muscular, I should say neuro and cardiac, right? So we're going to have fatigue and weakness, tingling or numbing sensation. We are also going to have the vomiting and nausea, difficulty breathing, okay, chest discomfort, and irregular heartbeats. So the arrhythmias, the cardiac arrhythmias, put them in the comments. You know what they are when it comes to hyperkalemia. What are we expecting to see? Now, sometimes even with high potassium, it can result in paralysis. All right. Now let's go to the diagnosis. How do we investigate the hyperkalemic patient? What are we going to do? So we are going to, number one, to investigate, we're going to run a blood test. We're going to run a blood test to determine that level of potassium in the blood. Now, remember, it is very important that the blood cells are not damaged during the specimen collection. Also, urine potassium, because potassium can be detected in a urine sample. So a 24-hour urine sample is going to also cause a patient to be able to determine if they're hyperkalemic. And then ECG is going to be very primary for the interpretation of what the potassium is doing to the cardiac cycle. And so, yes, when we think of hyperkalemia and we think of ECG changes, we do this. We make a T, right? And we go T, 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 tall T waves, okay? And then actually it flattens out to asystole when a patient has too much potassium. And that's just how I remember it. And I don't know, but I just think of tall, peak T waves, and then the patient flattens out. And so we know that's one of the reasons why we cannot give potassium IV push, because when you have too much of that, it goes right to asystole and everything is flat for your patient. So that is why hyperkalemia has to be seen as acute medical emergency, because we got to make sure our patient's cardiac cycle stays within the normal range. So those are the ways that we diagnose it. Treatment is simple. We have to lower the potassium. That's it. So everything that I'm talking about is going to lower the potassium. We have a diet where we are restricting the potassium in the diet. Diuretics. We know, you know, the loop diuretics. What are one thing that we teach our patient? If you're on a very powerful diuretic, a loop diuretic like furosemide, you know you got to watch your potassium level. Period. Insulin. Yes. Again, what you know for NCLEX is literally what you have been exposed to. And so a lot of these concepts in nursing school, we miss because we're learning things so fast. So these little nuances that insulin is excellent to lower your blood sugar, but insulin also helps to draw potassium from the blood back into the cells where it belongs. So we are recommended to give insulin in very acute cases of hyperkalemia because insulin will draw potassium back into the cells very quickly. Okay, so insulin is an ICU medication. You will see it all throughout the ICU, and it's not always related to lowering blood sugar. I have a critical thinking question here. I want to see if you're with me. If we give a patient insulin for hyperkalemia, what medication should we also give with that insulin? What should we also give with that insulin? What do you say? And you're thinking about the complications that can happen. That's what I want you to think about. What are the complications that can happen? So if I give a patient insulin, what is it going to do? It's going to lower the potassium for sure. But what else is it going to lower? It is also going to lower the blood glucose levels. So I should give insulin with dextrose, okay? Some sort of glucose for this patient because this is not a diabetic patient. This patient has hyperkalemia. So if I just give them insulin, if somebody gives you insulin right now, your blood sugar is going to tank. It is going to drop. So you need to have dextrose too. Sodium polycisterine sulfonate, that is going to reduce potassium from the bowels. Dialysis is going to reduce potassium from the through the urine. So those are the ones that you need to know. I hope you feel better about hyperkalemia from a pharmacological perspective because NCLEX, like I said, they can focus on the signs and symptoms, the EKG changes, but you should know how to treat it through medications and also what medications can cause it. Hypokalemia can present as a mild, a moderate, or severe. So again, the normal range is going to be the same, 3.5 to 5. So when we talk about a low potassium level, we are talking about 3 to 3.4. That's mild. 2.5 to 3. That's a moderate. And then also a lower than 2.5. That's pretty severe for a potassium level. Hypokalemia is going to be more common than hyperkalemia. So study both. The causes of hypokalemia are many, and this is why I think it's more common. I have here the acronym DITCH potassium. Ditch potassium and it will go lower. And these are things that just help me remember. So D in ditch is diuretics. Okay. The loop diuretics are going to lower the potassium. I is the intake is decreased. So we're not getting potassium rich food sources. T is for tube. If a patient has a nasal gastric tube, it will be pulling out the potassium rich gastric mucus and secretion. So that's going to lower their potassium. C, of course, is Cushing's syndrome. Cushing's syndrome causes potassium to leak out of the cells. And H is for heavy fluid loss. So if my patient is losing a lot of fluid, like I said, the nasal gastric tube, suctioning it out, if they are vomiting or if they have diarrhea, that potassium level is going to be low. We are going to see muscular changes in the clinical presentation of hypokalemia. That's fatigue and weakness, muscle cramping, twitching, constipation. These patients will have arrhythmias as well. You should absolutely know the cardiac changes associated with hypokalemia. Put it in the comments, study group. That's my challenge for you. Put those in the comments tonight. Share, care with this knowledge. And then frequent thirst and urinary frequency. So I put here muscle problems can occur during exercise too if the potassium level is low. And in severe cases, muscle weakness can result in paralysis and even respiratory failure. Very important, like I said, when you see sometimes athletes who have difficulty during their games or their practices, they're usually having some sort of cardiac issue, right? And it could be related to their electrolyte imbalance, but they are suffering in a way that is affecting their heart. And so knowing potassium, very important to the stability of your patient. Now, the treatment for a low potassium, it is going to range. So you can give oral potassium supplements. If you have ever seen them or if you've ever given them because you're an LPN and you're going back for your RN, what do these supplements look like? What does a potassium pill look like? When you have to give a patient potassium pills, you're going to be kind of like, I can't even believe I'm asking you to swallow this thing. They are huge. They are huge. Some patients are just like, just give it to me IV because I cannot take these pills. Like literally these pills are like this big, potassium pills. But that is going to be, of course, the least invasive way to treat potassium. If the oral therapy is not tolerated, like patient can't do it, they won't do it, then IV potassium replacement is used. However, what do we know about putting potassium in a patient's veins? Potassium burns. If you have to replace potassium IV, it can be very irritating to the veins. So you have to give it really slow, and then you have to give it in small amounts. If you need to give a large dose of potassium to a patient in a short amount of time, what is the best way to give it? All right, nurses, show up. What's the best way to give large amounts? Small amounts you can give through the peripheral vein. It's going to take all night. Your patient's going to say it hurts. Might have to put ice on the vein and make sure it's okay. But if we want to give a large amount of potassium, we need to put it through a central line. A central line is going to allow us not to deal with the irritants of the potassium to the peripheral veins. Potassium-sparing diuretics are typically used in patients who have normal renal function, but are prone to significant hypokalemia. So those are the ways that we treat potassium. This is very important for next-gen NCLEX. You need to know that before you replace potassium, before you correct low potassium, which electrolyte should be normal as well? What electrolyte helps you to reabsorb potassium? Do you know? Do you know? Or are you learning something? You either know this or you're going to learn something new. It is magnesium. Yes. If a patient has a low potassium level and a low magnesium level, the doctor will correct the low magnesium level first, because magnesium helps the body to reabsorb potassium. So if you have a prioritization question and your patient has low labs, which one do you address first? We would think we would want to go to the potassium because of the cardiac changes, but in fact, it'd be magnesium to help support potassium reabsorption. Okay, magnesium. All right. Okay. Nursing considerations before we get to the NCLEX questions. Oh, and the NCLEX questions tonight, so good. The nursing considerations for you: monitor your patient's intake and output. Okay, monitor both urine and bowel movements in your patient because changes in potassium consumption and elimination are going to be noticed through here. And also, it's important for you to know how that fluid is moving. Keep an eye out for signs of peripheral changes in the muscles. Potassium is necessary for transmitting signals from the brain to the muscles. So, potassium levels have been linked to muscle weakness, cramps, spasms, paresthesias, and reflex changes. Third one is check heart rate and blood pressure. That makes sense. Hyperkalemia can cause irregular pulse rates and reduce the I have here blood artery wall tension, which lowers blood pressure. Okay. Continuous cardiac monitoring. The patient has any kind of electrolyte imbalances, cardiac sodium, magnesium, their heart needs to be monitored. That just makes sense. When giving potassium IV, it is to be diluted, it is to be run through a pump. We never administer, I have this in red, never administer potassium chloride through IV push. Never give it through a bolus. And this is something that everybody knows, but I have actually worked with a nurse who was rushing, rushing with her assignment. The patient was ordered potassium. And this is the thing about it, potassium can come in vials, but you are supposed to remove the potassium and inject it into solution, into saline solution. Well, she removed the potassium and injected it right into the patient. Okay. She forgot that important step in rushing. And this is not a new nurse. This is a seasoned nurse, older than me, been on the floor for a long time. But in rushing, you just see the order, give 40 IV potassium, and you just do it, right? And so, of course, we you know how that ends. You know how that ends when a patient gets IV potassium in a bolus. They go into a systole, they go into cardiac arrest. And so I can never stop saying, just be careful, take your time, slow down. What you know can literally save somebody's life. And then I hear here, take safety measures when giving IV potassium. Anytime you give those high alert medications, potassium, heparin, insulin, you should be understanding that sometimes they are to be double checked. You double check them, even if your facility doesn't make you double check. Most of you work in facilities where you have two nurses confirm if you're giving blood, maybe even if you're giving morphine or something like that. Don't be afraid to ask somebody to check them and make sure that if you have signs of vesicant or irritation or phlebitis in your patient's IV, you discontinue it immediately, and you're monitoring the patient's cardiac status. Avoid experiencing sudden hypotension. So changes in the blood potassium levels can cause hypotension. So that is very important for us to know too. Aldosterone, vasopressin, they play a very important part in making sure that the blood pressure stays regulated. And then I have here, assess patient's neuromuscular condition. So, and again, we're looking for muscle weakness, fatigue when a patient has an electrolyte imbalance. Okay. And I want to stress to you that I love studying with you on Mondays and Wednesdays when we come here. But the work of passing NCLEX is really what you are able to do by yourself. So when you log off of this live, do you have a plan? Do you have a pathway? If you don't, my V2 system, people ask me, what is V2? V2 is my complete NCLEX review. And if you don't have it or you want to know what it is, get into the trial version of it. There is a free trial, no credit card needed. Just go to my website. If you go to remarnurse.com, you can get into the free trial of V2. You can get into the free trial of V2. I will be having a very special promotion on the price for V2 during Remar Nurse University. So just hold on, because June is coming. Every Monday in June, we will be doing Remar Nurse University. Somebody text my phone, said, girl, I didn't know you had a school. When did you get a school? Remar Nurse University is like my school. It's like my school because I have a system that I'm taking you from all of June. We're going to start June 3rd and we're going to graduate. All right, we're going to graduate on June 24th, and you will have completed a great pharmacology course. You will also feel more supported if you're in the V2. Remar nurses, your attendance is required to Remar Nurse University. Go to remarnurse.com/RNU to sign up. Okay, it's time for NCLEX questions. You know my process. Here is my secret sauce for passing NCLEX. It is doing the content first with me and then the questions. Okay, so content first, which we did. We went over hyperkalemia. We went over hypokalemia. So when you go into the Q bank, when you go into my question bank, you can answer questions about these subjects now. That's how it works. That's how we keep everything in one part, in one point. Shout out to everybody passing NCLEX. It's just so many of you guys who are showing up saying, hey, bam, I passed. Thank you. Thank you. Thank you so much for encouraging us. Winning Wednesday, you're the goal. Here's my first question. I want you to get 3 out of 5 because it's hard today. It's really hard. I'm telling you. Question number 1 is this. The nurse develops a care plan for clients admitted to the medical unit. What client should be closely monitored for hyperkalemia? Number 1, a post-TASBO client receiving an antifibrinolytic agent. 2, a third-degree burn client from a chemical source. 3, a client with congestive heart failure receiving thiazides. Or 4, a client with Cushing's syndrome secondary to a pituitary tumor. Here we go. Here we go. Here we go. Love this question. Hyperkalemia. Who's most at risk for it? I see the answers wrong. You're actually doing pretty good. Good job. I see the answer on the screen. It is number 2, the third-degree client. You know, when you have burns break down the cell structure. They traumatize the cells, and so the cells leak out what? They leak out potassium. It's very common for your patient to have hyperkalemia when they have severe burns, because that potassium is going to be in the bloodstream. Okay, you guys got that one. Oh, if you didn't know, number 1, because you're probably like, Professor Regina, what's a post-TASBO? I never heard of that before. All right. That is after a hysterectomy. It's a total hysterectomy. Okay. All right. Number 2, priority. The nurse receives the result of a blood test of a client admitted to the medical unit. The potassium level is 7. During the assessment, the client didn't show any signs of hyperkalemia. ECG results are normal. What should be the priority action of the nurse? Number 1, schedule for a sodium and magnesium blood test. 2, call the laboratory department to retake the specimen. 3, notify the physician of the abnormal findings. Or 4, administer potassium binder and repeat the test. We talked about this scenario, this exact scenario. So if you've been studying with me, we are here. You know what to do. Okay? If you have not been studying this subject, you're not going to get this right. Okay? And that's okay, because I want you to get it wrong here than on the exam. Do you know that the correct answer is going to be call the laboratory department or retake the specimen? Remember what I told you. Pseudo hyperkalemia is a thing, and it is when the elevated result is false, and it is because of an error in the specimen handling. And so when the specimen is not handled properly, you're going to get a high potassium level. But what we saw in the question, the ECG was normal. There was no other signs of hyperkalemia, no other findings of hyperkalemia. So I'm thinking pseudo hyperkalemia. It's a thing. It's a thing. All right. Now, question number 3. The nurse monitors a client receiving potassium chloride via intravenous infusion, okay, and notices a red lump and swelling on one side of the arm, okay. What is the most appropriate nursing action? Let me read that again. The nurse monitors a client receiving potassium chloride via intravenous infusion. She notices a red lump and swelling on one side of the arm. What is the most appropriate nursing action? Number 1, slower the rate of the infusion. 2, apply a warm compress to the infected area. 3, apply a cold compress to the red lump. 4, stop the infusion and remove the cannula. This is good too. What should you do if potassium is being administered, but this happens? Red lump, swelling on one side of the arm. What should you do? The most appropriate nursing action is 4, stop the infusion and remove the cannula, because we know that intravenous potassium can cause burning, irritation, or phlebitis at the injection site. The nurse's priority is to stop the infusion and remove the IV cannula as soon as there is any redness or pain. Yep. How are we doing? I feel like some of you have gotten the 3 out of 3. All right, so I'm about to turn it up to this question here. A nurse is caring for a patient who has just been notified via telephone of an elevated potassium level. After notifying the doctor, what is the highest priority action of the nurse? Number 1, monitor the cardiac rhythm. 2, administer the prescribed potassium supplements. 3, restrict dietary intake of potassium-rich food. Or 4, initiate IV calcium gluconate infusion. Very good. This is a good one. So you got information that your patient has an elevated potassium level. The doctor is called, so that's not the first priority. That's already done. I'm asking you, what's the second priority after telling the doctor? This is a good one. If you don't know, number 4, IV calcium gluconate, that's given to protect the heart. It doesn't do anything for the potassium level. It protects the heart. What are you going to do? I told you I'm turning up the heat because I want you to not be afraid of the NCLEX. I want you to be in situations where you're like, I have to go with my first mind. I don't know what I should do. The correct answer here, and I want you to hear my voice when you're taking the exam, saying, you can, you will, you must. Correct answer is number 1, monitor the cardiac rhythm. This is your highest priority. Okay, this is your highest priority because this is basically assessment. And this has to be done. Let me read it. Elevated potassium levels or hyperkalemia can pose serious risk to cardiac function, potentially leading to life-threatening arrhythmias, cardiac arrest, or other complications. Therefore, priority action of the nurse after notifying the doctor of an elevated potassium level, closely monitor patient's cardiac changes or vital signs. Either one. You need to be able to establish that before you do anything else. This is part of your assessment, because how did you get this information? You got this information over the phone. So somebody calling you, telling you, hey, that patient that I brought up, guess what? The potassium level right now is 7.5. And you're like, what? You call the doctor right away. But then when you go back to the patient's room, you're not giving any medications. You are not restricting, talking about diet. What's the first thing you're going to do? I got to get you on an ECG. I got to know where am I starting from? All right, because there's no indication that your patient already has these things. So as part of the nursing process, you better get some assessment going. You better get some assessment going before you give a medication. You got to establish those baseline. You have to know. You just got to know what's going on. And this is what I love about Next Gen NCLEX is that it's so real. It's so real. And that is what people are vibing with, that I can do this. I see myself doing this. Okay. All right. I'm so excited about you taking NCLEX. I'm so excited. I hope you see this opportunity as one to get excited about. Don't fear the NCLEX. Get excited about it, because when you show up and you know this stuff, you are going to pass the test. And then, yes, I'm talking to you. And then when you clear this, nothing is going to stop you. You're not going to be intimidated by anything else, because you have taken the hardest test on the planet. That's the NCLEX. All right. Monitoring the cardiac rhythm. All right, here's another good one. A nurse is developing a care plan for a client with hypokalemia. Which intervention should the nurse prioritize? Number 1, assessing the serum magnesium level. 2, assessing the client's IV access site for patency. 3, assessing the client's BUN level. Or 4, assessing the client's ECG results for cardiac status. So good. I know this is a good one. You don't even have to say it. I'm cooking you tonight. I'm cooking you up, because when you when you show up for the exam, you're going to be tried by fire. Okay. And so here you have everything you need to know. I tell you, you have everything you need to know right in that first sentence. A nurse is developing a care plan for a client with hypokalemia. What's the priority? And these are all important. You need to do all of them. But what is the first one you need to do? Assessing the client's serum magnesium level. What did I tell you about that? Assessing the client's IV access for patency. What do you know about that? Assessing the client's BUN level. What do you know about it? Assessing the client's ECG results for cardiac status. What do you know about that? That is what it comes down to. I'm not asking you, did you do 100 questions a day? Don't care about that. That does not matter right now. It comes down to, what do you know about the subject that you have studied and remembered? That's how you clear these questions. So you showing up here today, boom, amazing. The correct answer is assessing the client's BUN level. This is why it is necessary to prepare yourself with knowledge. Because what are we talking about? We're not talking about question banks tonight. We're talking about real subjects. Hyperkalemia, hypokalemia. And in hypokalemia, you need to establish the cause. You need to establish the cause when you are treating hypokalemia. So looking at a patient's renal function, because a poor kidney function can be a cause of hypokalemia. All the other things sound good. You want to know what your patient's serum magnesium level is. Yes, because I told you, if you don't know the magnesium level, you cannot correct accurately the potassium level. You need to be correcting the magnesium level first, but that's not a cause. The IV site. Yes, we need to have an IV site, because we're probably going to give this potassium IV if the patient cannot tolerate it orally. But the IV site is not a cause. Knowing the cardiac complications of hypokalemia, so important, but it's not a cause. But that BUN level can be a cause for hypokalemia. And we need to address the cause first always. Oh, it was such a good question. I have more of like this in the Q Bank when the time is right. When the time is right, you will get there. But you guys, Winning Wednesday is one of my favorite days of the week because we get to come through. How did you do? Did you get to 5 out of 5, 4 out of 5? I only asked you to do 3 out of 5. But when we come together as a community and we study, we learn, we grow. And so do not neglect this part of the process. All right. In the month of June, I have Remar Nurse University coming up. Have you signed up for it? It is a free NCLEX review every month and every Monday in June, Monday night, 8 p.m. Eastern time. What do you have to do? You have to show up for your NCLEX exam. That's what you do. All right, every Monday night, June 3rd, we're going to focus on pharmacology, cardiac medications. June 10th, renal medications. I'm going to mix it all together and just do pharmacology, part 1, June 17th and June 24th. That's somebody's birthday. This is somebody's birthday month. But guess what? You're going to be celebrating this exam. Part 2, June 24th, is coming up. Pharmacology, don't miss it. This is for somebody, all right? And let me tell you, register you. And do me a favor, register somebody else you know. And I don't even know if that's legal to do. I don't even know. But I know you have a friend that you study with usually. Send them the link, remarnurse.com. This is how you register, /RNU to sign up, to get the notifications, to get the workbook that we will be going over. And let me say, even if you have this book, RNU is different from this book. RNU is different from this book. So you want to get the Remar Nurse University workbook. And I said it's free. I'm going to email it to you, but you got to sign up. You got to give me your name and your email address for this specific event. Even if you came to my Nurses Week, even if you came to Love Your Content, even if you came to a 30-day challenge, whatever, I need you to sign up for this event now. This is a new event. This is a new opportunity for the month of June. And like I said, the reason I'm doing this one is because most of us want to go from point A to point B. Point A, I'm studying, I'm trying to get there. Point B, I need to have my license, okay? And you could do this to get there, or you could do this. And Remar Nurse University is that. It's like that straight line to make sure that you're accountable the entire month of June. So don't miss it. It's going to be fantastic. And it literally starts in days. As always, I am presenting the best NCLEX review materials from the V2, my V2 NCLEX program. It has everything that you need, all of my lectures. You know me. You haven't heard about it, go to remarnurse.com. I am shouting this from the roof. One NCLEX review, one message, one learning system. That is the process that I want you to believe in. You only need one. That's NCLEX V2. It has everything you need to succeed for your NCLEX exam. Mondays and Wednesdays are amazing. Thank you guys so much for watching Hyperkalemia Hypokalemia. I hope you feel more comfortable with the subject and you're ready to prioritize your nursing care, because you, in fact, can do this. You can, you will, and you must pass NCLEX, because with